US and Mexican authorities have urged the World Health Organization to declare a public health emergency over a fungal outbreak linked to cosmetic operations in Mexico. The WHO declares a public health emergency when a disease spreads between countries and a coordinated international response may be required to bring it under control. The US CDC has said that 2 people who got surgeries involving epidural anesthesia have died of fungal meningitis lately. The CDC has said that it has already identified 25 people in the US with suspected or probable cases of fungal meningitis. The CDC and the Texas Department of State Health Services had reported last week that 5 residents of Texas had become ill after having surgery either at the Riverside Surgical Center or Clinica K-3 in Matamoros. In the wake of this, both cosmetic clinics in the Mexican city of Matamoros have been shut. The procedures involved an epidural, an anesthetic injected into the area around the spinal column. Last October, a batch of a local anesthetic commonly used for operations such as Caesarean births was found to have been infected by the same fungus, leading to the death of 39 people in the Mexican state of Durango. Authorities in both the US and Mexico have urged people who had surgeries involving epidural anesthesia at either the Riverside Surgical Center or Clinica K-3 since January to get evaluated even if they are currently asymptomatic. Almost 400 people in the US and Mexico are being monitored on account of this. The CDC has urged anyone who had epidural anesthesia at either of those clinics during that time period to go to a health center, urgent care or emergency room as soon as possible and to be tested for meningitis even if they don't have symptoms. People who test positive for infection will be given antifungal medicines. Those who test negative will be asked to watch out for symptoms and possibly to return after 2 weeks of further testing. Fungal meningitis is not spread from person to person. Symptoms of meningitis can include fever, headache, stiff neck, vomiting, sensitivity to light and changes in mental status. They may take weeks to develop and be mild at first, but they can quickly become severe and life-threatening. Medical tourism in Mexico has become common as more and more people are seeking low-cost procedures and shorter waits for care, particularly for dental care, surgery, fertility treatments and other procedures. Many US citizens travel to Mexico for cosmetic procedures such as liposuction, breast augmentation and Brazilian butt lifts, which all require the injection of an anesthetic into the area around the spinal column.